After almost 100 days of lockdown due to COVID-19, New Yorkers were looking excitedly towards a ray of light, opening up the city again.
Remember where we were. We had 800 people die in one day. We had the worst situation in the United States of America. At one point, we had the worst situation on the globe. And we're now reopening in less than 50 days. The whole closure period has been about 93 days. Yes, it was a disruptive 93 days. I know. But look at what we did in 93 days. We went from the worst situation on the globe to actually reopening. That's where we are. We should be very proud of what we've done.
However, just as the city was getting ready to start opening up, the country was shook by another tragedy, the murder of George Floyd. New Yorkers began protesting in solidarity with Black Lives Matter, demanding justice for George Floyd and accountability for police brutality. On June 1st, New York State Governor Andrew Cuomo expressed concerns that these protests would exacerbate the virus, preventing a safe reopening scheduled for June 8th.
Just don't snatch defeat from the jaws of victory. We're talking about reopening in 1 week in New York City. And now we're seeing these mass gatherings over the past several nights that could, in fact, exacerbate the COVID-19 spread. We spent all this time closed down, locked down, masked, socially distanced, and then you turn on the TV and you see these mass gatherings that could potentially be infecting hundreds and hundreds of people after everything that we have done.
The combination of the COVID-19 pandemic and George Floyd's murder has brought to light racial disparities that have always existed in our country. It is no secret that communities of color have been hit harder by COVID-19 and that this link exists due to systemic inequities and a lack of services to certain communities. New York City Mayor Bill de Blasio attempted to address these concerns through increasing testing and support for those affected by COVID-19 in low-income hotspots, namely the outer boroughs and areas in which there is a large concentration of people of color.
We are setting up an apparatus that will allow us to support you if you're at home and you can isolate properly at home. Then this apparatus will support you safely separating at home. If you have to be in a hotel, we'll be able to help you as well.
Governor Cuomo commented on the hotspots, drawing a link between systemic racism and COVID-19 victims, and similarly encouraged increased testing.
These hotspots are not coincidentally predominantly low-income and minority communities. And that again raises the issue of disparity and inequality. We're going to be adding more testing sites in these areas. We need people to come out, get tested, find out who has the virus, who has the antibodies, who is possibly contagious.
However, the problem goes deeper than just access to testing. Between the disparities in medical care and the protests against police brutality, America's racist history is being thrown into light, and we are beginning to see just how many factors contribute to oppression of Black people, both in medicine and in criminal justice. Not everyone agrees with Cuomo's methods. In a town hall discussion hosted by MetroPlus Health, New York City Council Speaker Corey Johnson calls for accountability.
And it is a failure of government at all levels, I believe, that this has happened. So, I think it's important that we're honest about that we actually take stock in that there's accountability in that, because the loss of life that we have seen in New York City, the number of people that have been economically devastated coupled with that loss of life, and the racial disparities, the number of Black and brown New Yorkers who are essential workers, who are on the front lines, who have been exposed, who have lost their lives, who are infecting their families because of the situation that they're in and not having large apartments. We need to be honest about these things. And the one thing I will say, if there's any level of silver lining here, is that this lays bare in front of us the disparities and structural racism that we knew existed before COVID-19 hit. And now it is our responsibility to take that information and use that information to actually right the wrongs of the past.
Brooklyn Borough President Eric Adams further added that the lack of help for frontline workers requires accountability of elected officials in charge of the coronavirus response.
Over 70% of essential employees were Black and brown. Even if they were asymptomatic, they brought the disease back home to their family members, and we did nothing to prevent that from taking place. So this is important that we conduct this extremely thorough investigation.
Councilmember Adrian Adams commented, explaining that it felt as though Black and brown lives don't matter. It is a chilling reminder of the many, many reasons why the current racial equality movement needs to be called Black Lives Matter.
You know, when COVID-19 started to spread across New York City, none of the data provided by the city or state tracked cases. They didn't track cases, hospitalizations, or fatalities by race. I joined my colleagues on the New York City Council Black, Latino, and Asian Caucus to push for this statistical evidence. And unfortunately, when that data was finally released, it exposed a stark reality. From the beginning of the outbreak, the disparities of COVID-19 in communities of color have been shameful. The pleas of our communities have been completely ignored, as though the lives in our neighborhoods don't matter. From the infection rate, to the lack of testing, to the lack of access to quality health care. All of these factors have resulted in unnecessary loss of life. Black and brown bodies have been piling up, and this cannot be ignored. So let's call it what it is: systemic racism.
It's easy to see how, due to systemic racism, the Black and Hispanic community have been more affected by COVID-19. It has to do with economic devastation, the fact that they are more often frontline workers from not having proper housing, and ultimately this translates to other areas of life all over the country. This disparity is so revealing that it's no wonder it exists too in the criminal justice system, and that people are now protesting despite the health risks. The mayor suggested that while the issue of police brutality must be dealt with, anger due to the COVID isolation and grief at losing loved ones to it may have fueled protesters even more. Public health experts worry that despite many reports saying that protesters are wearing masks, there may still be an uptake in cases due to crowds gathering. Furthermore, police have used tear gas, pepper spray, and rubber bullets to manage protesting crowds, increasing the likelihood of respiratory secretions from the eyes, nose, and mouth, which is the main contributor to the virus spreading. Some are calling for an end to protesting in concerns for COVID-19, but the lack of healthcare, discrimination in healthcare settings, and the lack of resources to deal with COVID are part of the reasons why people chant the slogan Black Lives Matter. In fact, the NYPD was under scrutiny in May for their enforcement of social distancing. 35 of the 40 people arrested were Black. COVID-19 has been a great revealer, and perhaps the most revealing aspect of it is that despite over 100,000 deaths in the U.S., people feel compelled to choose between demanding equality through protesting or risking the spread of a deadly virus.